We're joined here on Flow FM by the Shadow Health and Ageing Minister, Anne Ruston. Anne, you're going to play our correspondent, I think. We're crossing to you to Mildura. What's been happening there?
Well, the last couple of days we've had the most amazing summit. It was the Regional Health Workforce Summit that was put on by the local member and the Shadow Assistant Minister for Regional Health, Anne Webster. And we managed to get an amazing group of not just locals, which was fantastic, but all the peak bodies in the health area got together, and we heard firsthand on the ground in community the issues that are facing this regional community. And whilst every community is different, it was quite clear that many of the challenges they're facing are the kinds of things we're seeing across the whole of Australia's regional communities.
And we've been talking about those across the Flow network and with you, Anne Ruston, Shadow Health Minister. Are there some solutions anyone's put forward that sort of raised your eyebrows and thought that could be worth a go?
Actually, it was really interesting about the real and practical measures that they were putting forward. You know, things like the frustrations at the length of time and the bureaucracy and red tape that you have to go through for an overseas trained health professional, whether that be a doctor, a physio or the like. It takes so much longer to get through the process in Australia than it does in many other OECD countries. Wouldn't really cost a lot to actually streamline that process. They were talking about, making sure that graduates had greater exposure to general practice because that's where the real workforce shortages are seen. Making sure that, we have a national sort of approach to things, national credentialing, national accreditation, all sorts of things that just make life a whole heap easier. But two of the really big issues that came out of it were two issues that the current federal government has imposed on regional Australia. That's the changes in distribution priority areas, which are where overseas trained doctors and bonded medical graduates are required to work a period of time in rural and regional areas. Well, the government changed that and now they can work in the cities. So guess what? They're staying in the cities. And also to fast track our regional skilled migration visas, which currently are in the go slow lane of immigration.
Is it concerning that there's that amount of problems that have been reached by that local community, given that they've got a training hospital there and the opportunity to train, say, nurses there in the local community, and even they're being hit by health workforce shortages?
Well, the whole issue of workforce shortages is something that's hit the whole of Australia. And so what we're seeing, because we're not taking a holistic approach to workforce, you're seeing, you're robbing Peter to pay Paul. So the Victorian Metropolitan Hospitals paying their salaried doctors and nurses in hospitals more and giving them bonuses means that many people are attracted to that additional support, and so they'll move into the state-run hospital system instead of staying in aged care or where they were previously working. So I think it's a lot to understand that this is an issue across the whole of Australia, and you can't solve for one problem by making another problem worse.
Yeah, we do end up now with a bit of a labour force arms race in terms of what they'll pay. Your state colleagues in South Australia saying that the Andrews Labor government is enticing people to work across the border.
Well, exactly. And that is the challenge, that when you've got one jurisdiction offering huge incentives, unless you're actually getting your workforce from outside of the country, all you're doing is actually exacerbating a problem that exists somewhere else. And the thing that we've seen has been that rural, regional and remote Australia has been a bit like the canary in the coal mine. It's always seen their first and it's seen their worst. And that's what we're seeing at the moment, is that the challenges, whilst they're national, they are far, far worse and more exaggerated in rural and regional areas. So the further you get away from the capital city, the more likely you are to have these sorts of workforce challenges.
And in Victoria, you can't get much further from the capital than up in the Mildura and the Mallee direction. The member for Mallee's with you. You're heading to Maryborough to talk about aged care. One of your other portfolio responsibilities. What's the concern that's arising there?
I have a very, very real and strong concern about the changes that the government has made in relation to 24/7 nurses and the care minutes that they're mandating to be brought into force by the middle of the second half of this year, are the impact that they're going to have on rural and regional communities because of this workforce challenge that we have. They're told that they have to have nurses on 24/7. They're told that they have to have registered nurses providing a certain number of care minutes every day for every patient in their care or every resident in their care, which is a fantastic idea, and I think every Australian would support it. But if you haven't got any registered nurses in your community and you can't get access to them, and you've got no ability to get some sort of an exemption, I'm really fearful that these places are going to close, and older Australians who've lived in their community their whole lives are going to be forced to move hundreds of miles away. And the first thing that happens then is that they're not getting a visitor every day because their family can't afford to drive to see them. So I think the lack of flexibility and understanding about the nuances and the challenges faced by regional communities is something that I think this government is shamefully neglecting.
Yeah, I note even the Bullokeshire Council in that electorate are offloading their aged care service provision to some other provider. They don't know who yet, but they're confident they'll find one. That's the sort of disruption we're seeing where we're applying Royal Commission recommendations that were made well before a pandemic when we've got labour shortages.
Well, that's absolutely the point, that when these recommendations were made by the Royal Commission, firstly they were guidelines, but they didn't have the workforce challenges that have occurred largely because of COVID and the disruption to migration. But there are a whole heap of reasons why we're seeing these workforce shortages, and there's been no regard for the changing circumstance in the landscape in the decisions by this government. Basically they've legislated the impossible, and now they're leaving aged care facilities and to pick up the pieces of a really ill-conceived and ill-timed decision by this government.
Well, we'd love to get answers from the Health Minister. He just doesn't seem to want to talk to us, but we'll keep trying. Anne Ruston, we really appreciate you joining us, the Shadow Health Minister, today on Flow FM.
My pleasure. Thanks for having me.